Afaf Meleis was born in Alexandria, Egypt, March 19, 1942. Her mother was the first person in Egypt to receive a Bachelor's of Science in Nursing from Syracuse University and was the first nurse in Egypt to obtain an MPH and a PhD from an Egyptian university. Dr. Meleis was always felt as though nursing was in her blood, and she admired her mother's passion for the profession. Dr. Meleis received her nursing degree at the University of Alexandria in Egypt. Once she came to the U.S., she obtained her master's in nursing and a master's in sociology. She also received a PhD in medical and social psychology at the University of California, Los Angeles campus. After these accomplishments, she then worked at the University of Los Angeles for a few years and moved on to the University of California, San Francisco, where she worked for the next 34 years, which is where the transition theory was originally developed. She is currently a professor of nursing and sociology at the University of Pennsylvania. While working on her PhD, she began her research for the transition theory. Her research was primarily focused on those who do not make healthy transitions and ways to help them facilitate healthy transitions. Her main research focused on global health, immigration and international health, women's health, and the theoretical development of the nursing discipline. During this research, she authored more than 170 articles in nursing, social science, and medical journals. To further develop her theoretical work, she initiated intensive literature reviews with a doctoral student at UCSF to discover how intensively transition was used as a concept or framework in nursing literature. She reviewed over 310 articles on transitions and developed the transition framework from there. In 2010, she collected all of her work in the literature that was related to the transitional theory and published the award-winning book, Theoretical Nursing, Development and Progress. This theory provides a framework to generate research questions and to serve as a guide to effective nursing care before, during, and after the transition. Transitions theory leads to further development of therapeutic nursing techniques that are in agreement with the different experiences of patients and their families in transition, which then promote healthy outcomes to transition. It is significant in helping clients transition into new parts of life and how nurses should intervene and educate clients. Transitions theory helps facilitate patients to make healthy transitions. It is a mid-range theory, which acts as a bridge between a grand theory and the nursing practice. These mid-range theories have more limited scope and less abstract than grand theories. They address specific phenomena or concepts which make them applicable to the wide range in the practice of nursing. This limited scope and adaptability allows for testing and makes it relevant to direct nursing care.
There are four major concepts in the transitional theory. The first is types and patterns of transitions. Under this concept, we have developmental, health and illness, situational, and organizational. The second concept is properties of transition experiences. Under this concept, we have awareness, engagement, change and difference, time span, and critical points and events. The third concept is transition conditions. This involves person conditions and the community conditions. The fourth concept involves patterns of response, and this includes process indicators and outcome indicators. The final concept is nursing therapeutics, and under this concept we have assessment readiness, preparation for transition, and role supplementation. Non-relational proposition are definitions of the major concepts. In this transitional theory, an example of non-relational statement is the concept of role insufficiency, defined as any difficulty in the cognizance and or performance of a role of the goals associated with the role behavior as perceived by the self or by significant others. Relational proposition is what links the concepts together. An example of a relational proposition that links this concept to transition theory is awareness of anticipated behavior patterns. Awareness is defined as perception, knowledge, and cognition of a transition experience. The level of awareness influences the response and perception of an individual undergoing a transition.
Future research topics related to the transitional theory could be teenagers' concerns transitioning throughout high school, or assessing cultural factors in transitioning throughout immigration.
Examples of meta-paradigm concepts include person, health, environment, and nursing. Under person, the process of a transition can involve major life changes, including life patterns, especially when the transitions may overlap. These changes can alter individual identities, roles, relationships, and personal behavior. The changes that occur to the individual's daily routine, environment, and personal interactions are altered by the framework of this transition. Under health, we have health and wellness achieved through different interventions provided by nurses and healthcare personnel. The transition includes the recovery process, hospital discharge, and diagnosis of chronic diseases. Health is defined as mastery as discovered through proxy outcome variables such as fewer symptoms, greater well-being, and the ability to cope with changing roles. In the environment, organizational transition represents an environmental meta-paradigm concept to changing environmental conditions. The change can affect the lives of clients as well as workers within the organizations. Individuals experiencing environmental transition may feel a sense of vulnerability as conditions and interactions change, possibly exposing them to potential damage, problematic or extended recovery, or unhealthy coping. And the last meta-paradigm is nursing. Nurses play a crucial role in transitions as they are the primary caregivers of the client and their families experiencing change. Comprehension of these specific transitions facilitates effective planning of nursing interventions with a goal of a positive outcome. The nurse can use this framework to assess patient-client environment, vulnerability, readiness, and support for their transition. The aim of the theory is to educate prior to, during, and following transition in order to increase successful transition and integration. The transition theory can be applied to clinical practice, especially in a variety of ways, including illness, pregnancy, and immigration. This is especially useful for nurses during patient recovery process, hospital discharge, and discussing the diagnosis of chronic diseases. Meleis conceptualized nursing therapeutics into 3 measures used as transitional interventions. The first is assessment of readiness through evaluation of transition conditions and patterns. The second is preparation for transition through proper education to ensure successful transition. And the third is role supplementation that is utilized to provide information and support regarding role incumbent.
In evaluating this theory, we found it to be a middle-range theory with a limited scope. It is less abstract and concentrates on the specific concept of transition, making it appropriate in countless nursing situations. We also found that the concept is simple yet can be transferable to a wide range of situations. As well, the model allows for a simple and visual representation. The lack of complexity allows for an increased understanding and increased application and testability. The transition theory allows for focus from many. It is a concentrated subject that can be broadened among many practices. It is relatable from transitioning from working to retirement all the way from transitioning into pregnancy. This is important because times like this can be confusing and alter one's sense of self, but if they understand transitions are global, it makes the experience more attainable. Meleis was able to successfully merge different types of transition patterns and properties into community and society. The logic behind this theory helps make it transferable to many nursing situations. It also allows for predictable responses to different types of transitional conditions. This theory gains its credibility through empirical evidence and its transference into the reality of nursing. The empirical testing is nursing specific and provides observable and unobservable outcomes and behaviors. This theory, being a middle range theory, branches a broad idea into a testable outcome and response, which helps it gain credibility. Its testability also provides credibility as the theory can be tested using many studies. An example is a study on post-hospitalization management of patients with COPD. It includes a transitional management plan for discharge of patients with COPD and therapeutic techniques during their transition from inpatient to outpatient.
The journal article we found is a study where the transition theory was implemented in a hospital to help patients with COPD transfer out of the hospital and manage their symptoms properly after discharge. The nurses in this study were able to show management skills very well. They made sure that the clients were adhering to their self-management plans, confirmed that they had no further questions after they were leaving the hospital. They were able to verbalize appropriate ways to take their medications after they were taught, and showed no evidence of major barriers that would affect them being able to be discharged. If the client showed any apprehension or showed that they were not ready for this transition within the 30-day period of the study, it was noted by the nurse and added to the collection of study. The nurses were able to properly educate the patients with their at-home regimens, connect them with COPD management programs outside of the hospital, coordinate inpatient and outpatient services and appointments, and have ongoing care plans with the patients. The nurses were also able to continuously develop education packets and videos to give their patients to study while they were at the hospital getting ready for discharge, and for patients who were already discharged to take with them. Non-adherence to this education directly correlated with the readmissions of these patients.
In summary, the purpose of this theory is to help nurses guide and educate their clients into healthy life transitions.